Hi, and welcome to the Ask Dr. Angela podcast with everyone's favorite OBGYN, Dr. Angela Jones. Have you ever been too embarrassed or shy to ask your own doctor about your, girl parts? Well, you've come to the right place to get straight answers. Feel free to ask Dr. Angela anything women's health related. Obstetrics and gynecology? She keeps it real. Pregnancy? She's been there, done that. Menopause? She'll get you through. Young or old, Dr. Angela's got you covered, girl. Now, here's Dr. Angela.
What's good, people? This is Dr. Angela, everyone's favorite OBGYN, and I would like to personally welcome you to episode 335 of the Ask Dr. Angela podcast. We are talking about all things PCOS today. That's polycystic ovarian syndrome. And I am over the moon, ecstatic to have Dr. Carly King as our guest today. Just a little bit of background on Dr. Carly. Dr. Carly is a registered naturopathic doctor. She practices in Ontario, Canada, our neighbors up north. She obtained her Doctor of Naturopathic Medicine and degree from the Canadian College of Naturopathic Medicine. She holds an honors Bachelor of Science in Kinesiology from McMaster University. Dr. Carly completed her internship at the Robert Schad Naturopathic Clinic and the Sherborne HIV Health Center, while also volunteering her time with Natural Doctors International at a clinic in Nicaragua. She has a clinical interest in hormone health, pregnancy, and infertility, hence my interest in speaking with her. So, Dr. Carly, just for our listeners, can you please explain to them what is naturopathic medicine? What is a naturopathic physician?
So I think we're a little bit different up here in Ontario anyways, Dr. Angela. I don't think they're registered where you are. And so in Ontario, we are trained as primary care providers. And so we are trained fairly similarly to medical doctors. We have a little bit of a different approach typically. And so I, like you, love evidence-based medicine, but I have a stronger focus on lifestyle medicine, nutrition medicine, and filling in the gaps. I am not in the emergency room like you are or delivering babies like you are. I am doing all of the things before that for fertility support,
Sure.
And hormone support typically as well.
And you also, have a bachelor in kinesiology, which I think is amazing because that speaks to, lifestyle. Whenever we speak of lifestyle, we're talking diet and activity. And for me personally, I never like to use the word like dieting. I always ask patients, how are you eating? Tell me about the foods that you're consuming, and certainly exercise. And really one of the things that really attracted to me the most was your general approach to medicine, and starting with diet and lifestyle. And what I really don't think that a lot of people realize is just the impacts that can have over your health in its entirety. So I love that about you.
Absolutely. And I love that you incorporate that in your treatment plans as well. That's really cool to see from an OBGYN as well.
So let's just jump right into this. Let's talk about PCOS. And I know that in the introduction, I said PCOS. Quite frankly, I had never even heard of it referred to that because I always just use the whole big, long polycystic ovarian syndrome. And then one of my patients was like, Dr. Angela, I think I have PCOS. I was like, you have what? I was like, what? And she was like, PCOS. And I was like, I don't know. And then I was like, oh, you mean polycystic ovarian syndrome. Is that what the young people are calling it these days? Because, I'm a little bit old. So let's talk about PCOS. By definition, I don't know that there's like a universally accepted definition of PCOS, but three of the things that we all know characterize it are, hyperandrogenism, which is excessive androgen production, ovulatory dysfunction, and of course that, broad characterization of polycystic ovaries. So, I'm going to make this a very back and forth, and I really prefer to keep it kind of just like very layman's terms. And so I'll punt this to you if you want to just give the listeners just a general overview of what hyperandrogenism is. What does it mean when we say hyperandrogenism?
Yeah. So typically with the hyperandrogen, that's a big
I
word.
know, I know.
Hyperandrogenism, we're looking at high androgens or high male sex hormones. And
Mhm.
so with PCOS, typically what we can see is either high male sex hormones like testosterone and or DHEA on blood work, or
Mhm.
we can see that we see these characteristics show up in the symptoms of PCOS. And so you can have
Mhm.
one or the other.
Yeah. So a lot of times when you see folks with PCOS that are affected by this hyperandrogenism or the excess production of male hormone, how that might present on a person might be increased acne, increased hair growth, whether it's, mustache, chin hair, hair on the back, chest, lower abdomen. So, clinically speaking, that's how it may manifest on patients. Now, with regards to those androgens that you spoke of, interestingly enough, the ovaries, which women have, don't only produce estrogen and progesterone. The ovaries are actually the primary producer of testosterone, or the male hormone in the female body. I'm going to say that again. The ovaries are the primary producers of testosterone for females. And of course, the adrenals also do secrete some male hormones. So let's talk about ovulatory dysfunction. What do we mean when we say, oh, she has ovulatory dysfunction? And you know that we see this in PCOS all the time.
Yeah, so this is a big one. So typically with that ovulatory dysfunction, we're going to see either we're not ovulating every month, or some months we may ovulate, but
Mhm.
others we may not. And so when we see that happening, that testosterone can definitely be one of the contributing factors with disrupting
Right.
why that ovulation is not occurring every month.
Right. So one of the things that I'm sure when in the patients that you see with PCOS is they'll present to you as, oh my gosh, my periods are irregular. And by
Mhm.
irregular, that's usually characterized as, not getting a period every month. And a lot of times women with PCOS, they can have, as few as 8 periods to no periods at all. But on the flip side of that, you'll see a lot of women with PCOS that will complain of, when you skip these periods and you go months and months and months without having a period. And then all of a sudden, when you get that period, it's so much heavier and so much longer than you might typically be used to. So let's get to our third characteristic of PCOS, the polycystic ovaries. How do you know that someone's ovaries are polycystic? And so one of the things that I just wanted to highlight with the definition of polycystic ovaries that may be a little bit confusing to people is that both ovaries do not have to be affected to have the diagnosis of polycystic ovaries. It can be one or it can be both. And in my literature, some of the old school literature, again, I told you, Carly, I'm a little bit old. They will oftentimes describe like a string of pearl appearance around the periphery of the ovary. And so, the American College of OBGYN, ACOG, which dictates how I practice, they will define polycystic ovaries as having like 12 or more follicles around the periphery of the ovaries. And so when you have all these little follicles that surround the outside of the ovary, that's where you get that kind of description of string of pearls. The other thing that you will sometimes see mentioned on an ultrasound is that the ovary in and of itself is increased in size or volume. So those are some of the characteristics that you may hear on an ultrasound report in someone that has polycystic ovaries. So, we've kind of like gone over, PCOS, what kind of makes up the definition of that, but, what causes PCOS?
Yeah, so that's a tricky one. We still don't really have a specific answer there. We
Exactly,
do know that there is
exactly.
this genetic component,
Right, right,
but
right.
and I think that's important to recognize, right? That
Yeah,
it's not like you did anything to cause your PCOS. There is this genetic factor there.
exactly.
So there is definitely that piece. We definitely see this insulin resistance
Yes.
underlying a lot of PCOS as well. And so, what that means essentially is that your cells aren't responding to insulin the way they should to drive sugars into your cells for energy. And so, we get stuck in this place where we need more and more insulin put out. This creates more inflammation. This can cause that ovulatory dysfunction and those higher levels of androgens as well. And then we have this extra piece with that inflammation. And so
Hmm.
we do see higher inflammation levels in people with PCOS as well. And this also seems to cause ovulatory dysfunction and can drive up those testosterone levels at the level of the ovary as well. And so it's complicated.
It is very complicated. And I'm happy that you mentioned that because, everyone thinks that in medicine, we have all the answers. Nobody does really know what causes PCOS. And I think that the genetic piece and the fact that it exists is really important to mention, because I know sometimes when I see patients, they'll be like, oh yeah, my mom has PCOS and she wanted me to be checked for it. And then, the whole piece about the insulin resistance and, just the great overview that you gave about insulin. Insulin is so essential in our bodies because that's how your cells, utilize the sugar that you consume to produce energy. So, when that's not working correctly, that leads to like a world of difficulties. One of the things that I'd like you to touch base on, specifically from your naturopathic standpoint, is, this thought of inflammation, the word inflammation. Can you just, kind of relay how that inflammatory process might affect our bodies and well-being in general?
Yeah, so that's a great question, Dr. Angela. And I think that we still don't know all of the answers there. The inflammation piece is a little bit newer in the research for PCOS.
Sure.
We do see quite a few markers in the blood work that will go up with PCOS. And so one of the big ones that I'm sure you see as well is this C-reactive protein, or CRP, can actually be doubled in PCOS patients. And so what we're seeing with that high level of inflammation in the body is that it can actually affect the ovarian function and what the ovaries are able to put out hormone wise. And so we can see that high levels of inflammation can contribute to that disruption of ovulation.
Sure.
And then can also further drive that testosterone. And so it seems like there is this correlation between the high insulin affecting the high inflammation, and the two of those pieces together blocking that inflammatory piece. We also will see with that higher insulin level that it can lead to higher rates of things like visceral adiposity, so higher fat around the organs in the abdominal cavity that can also drive up inflammation as well. So there's that piece as well.
Sure. That's great. So, some of the symptoms that people with PCOS might actually see, we've hit on a lot of them already, irregular periods, the heavy bleeding, the sign of hyperandrogenism, in English, excessive hair growth, greater than 70% of people that are affected by PCOS will have, excess hair growth. Insulin resistance, the telltale sign that, and I see this all the time with insulin resistance, is that acanthosis nigricans. And for those of you who are like, what are you talking about? Acanthosis nigricans is when you see that discoloration on your skin. It's a darkening of the skin. Places that you will notice it will be in your axilla or like under your arm, sometimes underneath the breast. As an OBGYN, I notice it specifically in the growing region. Okay. And that is like a very telltale sign of insulin resistance. Certainly PCOS and how it affects our bodies in general. You've already touched on this: infertility, irregular cycles, and ovulation. Okay. If we're not ovulating, do we get pregnant? Exactly. Dr. Carl is like silent, like, exactly. So, and then of course, some of the things that you've mentioned, the inflammation, PCOS and obesity, the excess androgen levels. We know that all of these things can in turn affect things and our risk factors for things like high blood pressure, elevated sugar levels, and cholesterol, decrease in the good cholesterol, which technically is HDL, and an increase in the bad cholesterol, which is LDL. And, with all of these irregular periods, skipping, cycles months at a time, that thickened lining, the heavy bleeding, in my realm, those are all risk factors for endometrial cancer. So it seems to me, Dr. Carly, that PCOS causes a lot of symptoms, but it's something that I think actually you can't just kind of put on the back burner, because it can impact, people's well-being in many different ways, in many different ways. So one of the things that I wanted to, kind of come full circle. And, we talked about PCOS, what it is, symptoms that are associated with it. But you and I both speak a lot about diet and exercise. And this is one of the main reasons that I wanted to have you on, because this is what you do. Kinesiology is the study of movement and, more natural things. For me as an OBGYN, I can always say, we can treat PCOS. I like to leave like the hormones and stuff, that's not my first go-to. I'm a huge lifestyle, eating well, and certainly being active or moving. What are some of the more natural things that you recommend to treat PCOS?
Yeah, I love that you're looking at that as well, Dr. Angela, because I hear so often in my world that, oh, we just need to worry about fertility and don't worry about it until you try and have a baby. And it's a chronic disease and it affects the whole body, right? It affects more than just the ovaries. And so we do really want to look at that nutrition and lifestyle piece. And there is a ton of research on nutrition for PCOS, which is cool because we don't always get that in women's health conditions. And so when we look at the diet piece, I'm on the same page as you. I don't like to look at dieting. I don't like to look at specifically weight loss as a priority. We want to figure out how to manage that insulin resistance piece, because that's the biggest thing that underlies a lot of those chronic health conditions later on. And so where we want to take that research is looking at how we can modify that risk for insulin. And so what we see in the research for nutrition is that most of the research points towards kind of a Mediterranean type diet as being effective for PCOS, which makes sense because we see that with cardiovascular disease, diabetes as well.
Sure.
And so looking at lots of whole foods, lots of fruits and veggies, whole grains, lean proteins like poultry, fish, those healthy fats, olive oil, avocado, nuts and seeds, legumes, and replacing some of our higher processed foods, higher refined sugars, higher refined carbohydrates with more of these whole foods. And so there's a lot of misconceptions, I think, with nutrition and PCOS too. We see a lot of these like keto diets and low carb diets.
Sure.
There isn't any evidence on that. There's actually no evidence for keto for PCOS. And even if you look at the lower carb diets, they're actually moderate carb diets. And so we're actually taking people from a 60% carbohydrate diet to a 40%, which is moderate. Like that's not a low carb diet. We want carbs. Carbs give us energy. Focusing on protein with every meal as well. And so protein is going to blunt the effect of how much insulin we require in a given meal to drive our sugars into our cells. And so adequate protein. So again, these lean meats, fish, eggs, legumes, and then adequate fiber, where we're looking at those whole grains and fruits and veggies with each meal throughout the day. There is no evidence for gluten-free PCOS either. And so that's another misconception I hear a lot on social media. Unless you're celiac, you don't necessarily need to cut out gluten. Dairy does have a little bit of evidence, mostly for acne. If acne is a chief concern with PCOS, we may want to investigate reducing dairy intake. However, that being said, we also have research where we've given people a paleo diet to follow, but allowed them to have an ounce of cheese daily. And we see that these patients will actually follow their diet better if we allow them to have the cheese in their diet. And so again, we want to find something that's sustainable. We want to find something that is going to be easy to follow over the course of a lifetime. We don't want to restrict a ton of different foods. We're looking at that longevity of following a nutritional plan to keep that going for the long term.
Sure.
Yeah, we have some specific foods that are also found to be beneficial for PCOS in the research. And so soy protein does come up, which we see be beneficial with regards to that insulin resistance piece.
Sure.
Likely because we're also replacing saturated fat from some of the animal sources. And then we also see things like ground flaxseed being beneficial. And so 2 tablespoons of ground flaxseed daily has also been shown to be effective for lowering that insulin resistance, lowering inflammation. And that's an easy one to throw in. Oatmeal,
Sure.
smoothies, yogurt, if you are including dairy in the
Sure.
diet. And then we do have a little bit of evidence for vinegar in the diet. And so this isn't one that I would say is a necessity necessarily. If you hate something like apple cider vinegar, you do not need to include it, but we do have some evidence showing that it can reduce insulin resistance and lower the load of insulin required per meal. And so an easy way to include that guy would be to mix it with olive oil and use it as a salad
Sure.
dressing. It's an easy
Huh.
add something as opposed to taking something out. Yeah, so that's kind of the approach I look at with diet. We like to add more foods in. We like to focus on the whole foods, that consistency with getting the blood sugar balance there, as opposed to taking a lot of things away,
Sure.
restricting massive calories, doing long-term things like fasting. We just don't see that in the evidence as being beneficial. We really don't like to remove food groups unless there's a really, really good
Sure.
reason.
Sure. And with regards to exercise for,
Mhm.
PCOS, are there any types of exercise specifically that you can recommend, encourage?
Yeah. And so again, I think the sustainability is key for exercise. Most of the research points towards aerobic activity, but we are starting to see some evidence for resistance training as
Mhm.
well. And so ultimately, we do see that both forms of exercise are beneficial for insulin resistance. We see that we lower the need for insulin to drive sugar into the cell
Sure.
kind of exercise. And so we want to find something you love. Do something that you enjoy that's going to be consistent in your routine, as opposed to trying to fight for something that you don't love.
Exactly.
It's not going to work. You're not going to keep at it, right? Yeah, I know you're a big gym goer over there too, Dr. Angela. So I
But
know you
you know
both
what?
appreciate the
I gotta
benefits
tell you,
of exercise.
I appreciate that so much. And I also really appreciate your general approach, because anyone that sees me, I always ask about lifestyle, and I always specifically speak to, what do you eat on a day-to-day basis, and what does your activity include? Because you're absolutely right. You know, when you hear that word dieting, most of the time that's punitive. And so I prefer to focus on lifestyle, because lifestyle is something that you do and can incorporate every day. Your diet should not be so restrictive, because when you view it as not being able to do some of the things that you like to do, are we going to follow that? The answer to that is no. And you're right, I am a big gym goer, because exercise just makes me feel better, and it helps me to, relieve a lot of stress. And really the flip side of that is I personally feel like I can't really preach health to my patients if I am not an example of health. But again, that's just me. So, when you talk to patients, just trying to find something that's going to kind of fit into their wheelhouse with regards to activities that they may enjoy. That is when people are going to be more adherent. And then just to kind of bring this back to the whole PCOS piece, there's some data that suggests that even as little as a 5 to 10% weight loss positively impacts, PCOS, menstrual cycle regulation, and some of those other symptoms of PCOS that we just mentioned. This is what we've been talking about this entire podcast. And exercise does a body good, because it also positively impacts, even in those people that have other chronic medical conditions, whether it's diabetes, high blood pressure, high cholesterol. Lifestyle, pays dividends. That's like one of my favorite lines. Lifestyle pays dividends, because I've seen people with these ailments that I just mentioned, and through some lifestyle modifications, they've been able to come off of some of those chronic medications, because their overall health has been improved. I mean, Dr. Carly, you got me fired up over here. I'm like so excited to have this conversation with you, because I'm sure, like you, I see people with PCOS every week, and I see a ton of patients a week, but this is like a visit that I have a couple times a day, about PCOS. So I'm excited that you have been on this podcast, and you've given people a lot of really good information about some just normal, natural, everyday things that you can do to positively impact your health. And I love that you gave some recommendations, like some solid recommendations for diet, because I can tell you to eat better, but I don't know that I'm necessarily the one to go to say, well, you need this much protein, you need, these alternatives. That's just not what I do. I refer someone to them. So let me ask you this, Dr. Carly, if people want to learn more about what you do and your approach to medication, why don't you tell our listeners how they can reach out to you or find some of the resources that you've shared with us today?
Yeah. So one of my favorite places to hang out is on Instagram. And so you can find me there at dr.carlyking.nd. And I do share lots of nutritional info there, lots of advice on PCOS and other hormonal conditions as well. So you can come hang out with me there and see what we're up to.
That's fantastic. So just a general recap, PCOS affects a lot of people. We've seen kind of, that triad of hyperandrogenism, ovulatory dysfunction, polycystic ovaries on ultrasound. We've gone over some of the very obvious signs and symptoms that you might experience, hyperandrogenism, more hair, facial, back, lower abdomen, increased acne, heavy periods, irregular periods, ovulatory dysfunction, issues with fertility. I mean, really the list goes on and on and on. And Dr. Carly has been, so kind, to share some alternative lifestyle options that we can all do, for those that are affected with PCOS to be able to improve their conditions. So in closing, you all know I always give you like a word of the day, something that inspires me. And Carly, I have these books that I've had since I was like, honestly, I think I got these books when I graduated from high school. That's how old they are, but I still refer to these. And so, this tidbit for today comes from Life's Lesson book. It's like a life's book on, instructions from your day-to-day life. And today's lesson is I think it's 3 or 4. And it says, judge your success by the degree that you are enjoying peace, health, and love. Okay. Not money, not, those are all tangible, but peace, health, and love. So Carly, thank you so much for being a guest on my podcast. For those of you who are new to the Ask Dr. Angela podcast, I am Dr. Angela, everyone's favorite OBGYN. You can find me at www.askdrangela.com. That's ASKDRANGELA.com. There you will find a wealth of information from my blog posts to my podcast, and there are a ton of those, as well as all of my social media channels. Carly, thank you again for being a guest. This was a wealth of information for all of us. In closing, thank you all so much for listening. I cannot wait to see you all for episode 336 of the Ask Dr. Angela podcast. Until then, remember to choose happiness.
Thank you for listening to the Ask Dr. Angela podcast. For more information on women's health and the show notes for this episode, please visit Dr. Angela at www.askdrangela.com. While you're there, don't forget to leave your own message for Dr. Angela. See you soon. All of the information provided and discussed in this podcast is for educational and informational purposes only and should not take the place of consulting a physician. This podcast is not intended to diagnose, treat, or cure any disease or illness and does not and should not replace treatment from a medical professional. Listening to and participating in this podcast does not create a doctor-patient relationship between you and Dr. Angela Jones. If you need medical advice or assistance, you should consult a physician. Listening to and participating in this podcast is subject to the terms and conditions posted at askdrangela.com/terms.